probably seized close to 200,000 dosage units last year, where it was something that we didn't even deal with before. Now it makes up about 90% of our work.
Northwest Montana Drug Task Force Commander Alan Brooks says they seized their first load of fentanyl in Northwest Montana back in 2021.
And I think there was 1,900 pills on that seizure alone. Over the last 4 years, we've seen that dramatically increase.
The Northwest Montana Drug Task Force is a partnership with regional law enforcement, tribal communities, and the Department of Homeland Security to stop the flow of dangerous drugs entering Montana.
Narcotics, dealing with other drugs, methamphetamine still large, but the fentanyl one is the one that's impactful, obviously, because of the accompanying overdoses that are, growing and tragic.
Brooks says the majority of fentanyl they seize originates from Mexico and works its way up the west coast before entering Montana.
Now we're seeing, as of late, a lot of powder, so the raw fentanyl compound, and that's obviously alarming for us. There's a greater risk of overdose. The effect on the street is a lot stronger.
Brooks says drug trafficking organizations are preying on Montanans as they see a high demand for product and fewer law enforcement patrols compared to other states. He calls it a modern-day gold rush for drug traffickers.
We're seeing profit margin increase 100-fold. Dosage units that cost less than $1 down in southern states are going for as much as tens to $20 on the reservations. So the price margin's huge.
Brooks says the fentanyl they are seizing is extremely potent, leading to an increase in overdoses, especially in young adults and teenagers.
Where we've had overdoses with juveniles, and that's just obviously something that we haven't navigated in years prior, but because of the dangers and potency associated with this drug, it's now occurring.
The task force, which covers an area from Lake County all the way to the Canadian border, relies on grant funding to operate. Brooks says more support on a city, county, and state level would help them fight this epidemic.
Many a times I've sat with many a family and many of individuals who become victim to this and wondering what more can be done. And again, having more resources is always going to be helpful.
In Kalispell, Sean Wells, MTA News.